Welcome. Today we will be discussing the 2019 update to the physician and nurse discharge workflows. This video provides the reason for the change, an introduction to the workflow for nursing, the documents produced from the workflow, and the methods to improve the discharge process in the future. Since go live, many have identified areas where the existing discharge process and documentation had opportunities to improve. During the sprint session held in April of 2019, a multidisciplinary team assembled to provide input and improve this update. With the update to the discharge process, we are introducing the nurse roles to the use of workflow M pages. These M pages provide a flexible yet structured way to complete documentation into notes and instructions. On the left-hand side of the work area are the components of the M page. These components can be moved by click, drag, and drop methodology. This does not change how it is printed, just how you, the nurse, interact with the information. From top down, how I have it configured is discharge planning, which includes the information from the nursing and social work on anticipated discharge, date, time, location, equipment, skilled services required, and special services or community resources needed post-discharge. The care team, those care providers with a relationship to this encounter. Our problem list, those diagnoses outlined by the provider throughout the stay and chronic. Follow-up instructions. If not provided, the nurse can add follow-up guidance. You can also see below to see what has already been included, and you can see the current scheduled appointments within MHS Genesis. Discharge documentation. These fields are populated by the nurse case managers, social workers, and discharge planners through their power forms. Discharge documentation is also the location where the nurse documents their discharge. Here, you can click the plus sign and the arrow beside it to see the drop-down. For adults patients, you select Nursing Discharge Summary, Newborn, Pediatric, or OB. Also, you document the valuables and belongings given back to the patient. By selecting this, it opens the power form you're used to seeing with the previous discharge process. Select and fill out the form as needed, and hit Sign Form. At the end, you will notice it now shows up here. The orders component are the orders that are still active in the system. Discharge medication reconciliation has your medication reconciliation process up at the top and the current active prescriptions for the patient. The immunizations component allows you to compare the patient to the CDC recommended schedule to see if they need immunization prior to discharge. Quality measures are those elements in which the hospital is evaluated on in regards to immunization, substance abuse, and tobacco use. This is a great way to be able to order influenza vaccine, document a contraindication, or conduct the documentation requirements to meet these quality measures. Patient education, there are two elements. There's the quick suggestions, which is what the system would use based upon the diagnosis of the patient, and that which is already added. You can also see down here there are medication leaflets. The documentation section is where you will see the pharmacy consult status. You must have a pharmacy consult to discharge. For outstanding orders, these are the orders that are currently ordered on the patient that have not been moved out of the ordered or pending status. Goals and interventions is a new component added to our M page. These allow the provider and multidisciplinary team to outline objectives for the patient to achieve post-discharge. These are not IPOC elements. This does not chart to your IPOC. Once all required fields are satisfied and charting elements completed, click the blue link at the bottom. The top link, Discharge Documentation, will produce both documents at the same time. The following links are each specific document produced. If you click the link and this window opens, close the top window and your documents will be showing. The two documents produced are the clinical summary and the inpatient discharge instructions. The clinical summary is your nursing discharge note that will be saved in the chart closing out your care. This is not printed out. The other note is the inpatient discharge instructions. This is the form printed and given to your patient. This note pulls from the provider and nurse documentation to present all pertinent data to the patient. Verify the information. Vitals are populated from iView data. Review the education elements, and then hit Sign and Submit. This window pops up. You validate that the type says Inpatient Summary, Position, and Inpatient Discharge Instructions. Then click Sign and Print. You must validate that the template says Patient Discharge Instructions, select your printer, and hit Send. You can now close this window. The information will then print to your printer. At this time, there is discussion at the DHA level whether a signed document needs to be scanned back into the system. Until DHA policy is produced, follow your local facility's policy. After you've signed your inpatient discharge instructions, you can sign and submit your clinical summary. Again, we just validated it says Inpatient Clinical Summary, title is Clinical Summary, and hit Sign. This now saves it in the instructions, and you can go about your standard depart process in PM Conversation to discharge your patient. The Inpatient Discharge Instructions has the following components. The Inpatient Discharge Instructions has the following components. What to do next. This is comprised of instructions from the provider. This tells the patient what to do in plain language. If they have already scheduled appointments, they will show up here. If the patient needs to schedule appointments, it will show here. In the follow-up section, if we would have said somebody was going to call the patient, that would show here. If there has been home equipment or services or treatments, those also would populate here. Moving down, you have the information for the visit. Who took care of the patient, the admitting diagnosis, the final diagnosis, the goals identified by the provider and the multidisciplinary team, tests that were performed, the medication list, and procedures. Also, from the iView, you will see the discharge vitals. Moving down, you'll see the medication section has a table. In red, you will see unchanged if the medication is unchanged. If it is a new medication, it will say new. If the patient has discontinued medications, a second table will show up beneath this primary table that will say, stop taking these medications. If there are any test results, they will show here. If you have immunized the patient utilizing barcode medication administration, they will show here, and any allergies previously charted on the patient, the patient's problems list, and any devices that are implanted or removed on this visit. Following all of that is the education materials provided to the patient, and below it are the CMS mandated education contact information. This complete documentation provides a clear, readable methodology to relate to your patient how to best take care of themselves following discharge. This is an ever-improving system. If you discover an element is not working appropriately, please log a GSC ticket with Discharge Update in the summary field. If you have a recommended improvement, please develop the recommendation, route through your ISB or ISC for analysis and approval, then submit a change request. The DHA Health Informatics will then prioritize and work collaboratively with our VA counterparts to implement those changes. Thank you for your time.